Welcome to The Explainer. Today, we are breaking down a series of sources that level some pretty shocking allegations against Los Angeles County's child welfare system. Now, the information we're about to cover paints a really disturbing picture, and I want to be clear. It all comes directly from the materials we've analyzed for this explainer. So let's start with just a number from one of our sources, 128. This, they report, is the number of children who died in LA County in 2023, while they were supposed to be under the supervision of Child Protective Services, or CPS. It's a heavy figure, and it's the one the authors used to frame their entire argument. And that number leads us to this quote. Wow, this really captures the core argument of the materials we're looking at. The authors aren't just saying the system is incompetent, they're alleging it has a fundamentally broken and, frankly, dangerous purpose. Okay, let's dive into what they mean by that. So our first section really gets into that core accusation, that LA County CPS isn't just failing, but that it's in a state of catastrophic crisis, and that this might actually be by design. When you look at the numbers presented in the sources, the scale of this alleged crisis is, well, it's just staggering. The sources point to over 6,800 child abuse claims. These have apparently led to 882 lawsuits against the county, resulting in settlements that are projected to cost a whopping $4 billion by 2025. So the crucial question the sources ask is, why? Why is all of this happening? And that why leads us straight to the alleged financial engine behind this whole crisis. The sources argue the system isn't driven by a mission to protect children, but by a powerful and, they claim, deeply embedded profit motive. At the heart of this whole allegation is a federal program called Title 4E. Now, on paper, its purpose seems great. It's designed to help states pay for the costs of caring for kids who have been removed from their homes. But here's a twist. According to the sources, they claim this system creates a really perverse incentive. Because the federal funding primarily flows after a child is removed from their home, the system is, they argue, financially discouraged from funding things like prevention or in-home support that could actually keep families together in the first place. And get this slide really puts the scale of that alleged incentive into perspective. The sources state that LA County receives over $200 million a year through this program alone. This, they claim, makes removing children a huge and reliable revenue stream for the county. So, this alleged financial pressure, the texts claim, creates these impossible conditions on the ground. You've got social workers buried under caseloads of over 100 children, making real investigation almost impossible. So what happens? Simple signs of poverty, like a dirty home, are often mislabeled as neglect. And the sources claim Black families are targeted for removal 2 to 3 times more often than other families. And it all comes full circle back to this figure, that $4 billion settlement. The sources tie a huge portion of these 6,800 abuse claims directly to kids who are allegedly abused after being placed into the foster care system itself. This leads to a really critical and, honestly, chilling question posed by one of the texts. If the system is incentivized to remove children, does that process just start after they're born? Or could it possibly begin even before? And that question takes us to the next part of the source's argument. It focuses on a public health program that seems, on its face, to be completely wonderful, the Nurse-Family Partnership, or as we'll call it, the NFP. I mean, its stated mission is to provide guidance and support. You have nurses visiting young, low-income, first-time mothers to help them have a healthy pregnancy and become good parents. It sounds like a perfect safety net, right? But the sources we're examining allege something else is going on entirely. They allege a darker, hidden agenda. The claim is that the program's real goal isn't to support mothers, but to reduce future CPS costs by identifying high-risk pregnancies and then encouraging abortions, sometimes even offering financial bonuses for nurses who meet certain quotas. And here's the alleged financial logic the source presents. It's pretty stark. They calculate that every birth that's averted could save the state a potential $25,000 in future foster care costs. You offset that by the, say, $400 cost of an abortion, and the source alleges this creates a net financial gain of over $24,000 for the state. This quote, which one text attributes to a sealed deposition from an NFP nurse, just encapsulates the shocking core of this entire allegation, that public health was being weaponized for financial outcomes, not human ones. The sources then zoom in their focus onto a single figure who they claim sits right at the intersection of these systems, the longtime director of LA County's Nurse Family Partnership Program. One academic source draws this timeline, connecting the career of NFP director Jeanne to the moral panics of the 1980s. It notes her career at the Department of Children and Family Services, or DCFS, began right in the middle of the Satanic Panic era, and suggests this environment may have shaped her professional worldview on child abuse. Citing anecdotal family testimony, the source then goes on to allege that she holds some very controversial personal views, including support for eugenics and government-licensed parenting. The source uses this to position her as a kind of gatekeeper of familial reproduction, whose personal ideology could, they claim, heavily influence the whole program's direction. So, how did the sources tie all of this together? They connect all these different threads, the money, the prenatal program, the figures in charge, and they weave it into one big, overarching conclusion. The final argument is this: these are not separate, broken systems. Instead, the authors contend they are all interconnected parts of a machine that profits from the dissolution of vulnerable families, a machine that gets started before a child is even born. And the text don't just present these allegations, they end with the direct call to action. They urge readers to investigate their own local child welfare systems by filing information requests, and to demand that federal funds be used to support families, not to separate them. And that leaves us with the final, provocative question posed by all this material. The sources have laid out their case with some startling detail. But, the path from an allegation to an established fact requires scrutiny, investigation, and accountability. The authors leave it to the public to decide who is ultimately responsible for finding the truth here.